Sir, good to see you.
Good to see you too.
Yes, sir. So,
All clear?
yes, sir, all clear.
We'll
So,
start then.
yes, sir, we'll start then. Okay, so, good afternoon, all. Today we are, on behalf of WYHF, we are going to discuss the importance of research in cardiology. And our chief guest, guest of honor is Dr. Professor Tom Devasia, who is my mentor for my PhD, who was my mentor and who shaped my career in cardiology. And this is our great honor that sir is with us to discuss the importance of cardiology and the importance of research in cardiology. And so WIHF is a non-profit organization which is working with the youth of our country, India, right now to reduce down the mortality and morbidity of cardiovascular diseases. We have many committees under the WIHF umbrella, and we are working towards that. So today, without wasting our time, I'll introduce Sir. Dr. Tom Devasia is professor and head of department at Department of Cardiology, Kasturba Medical College, Manipal, Mahe. So, sir, uh, I welcome you to the discussion. And my first question would be like, how important is the research in cardiology?
Well, nice to see you again, Ajit, and good evening to all. And regarding the question, what is the importance of research in cardiology? Let us say, let us ask ourselves the question: how have we reached here? Not only cardiology, in terms of science and technology,
Right, sir.
it's with research. Where do we go from here, and how do we go from here? It's also by research.
Right, sir.
So, how we have reached in terms of science and technology, entire mankind, is by research. Research and development has been very important along decades and helped mankind so much so that we have reached this position today. So, it is very important that we think properly, act properly in terms of research and development so that research idea, it starts as an idea, and then once you do the needful in terms of research, then you progress as a whole in terms of science, technology, be it cardiology or any other science.
Right, sir. Okay, so very nice, sir. And I'll move to the next question. Sir, my question actually, I wanted to ask you even from my PhD time, you know, like how do you manage your research projects in such busy schedules in OPDs, in wards, in interventional labs? I was wondered, always I wanted to ask this question to you, sir.
Now, no, Ajit, the time management is very important. So also is the interest in research.
Yeah,
I'm very sure many clinicians like me have a lot of interest in research.
correct, sir.
But it's also important that you keep some time dedicated for research and you have some ideas.
Right,
Sometimes it may not be your own ideas. When you work alongside a team of young researchers, be it Ph.D. students, DM students, or even MBBS students, you have so many ideas. And when you have a team of people with common interest and ideas working alongside you, you motivate them, they motivate you, sometimes you motivate yourself, then we will be able to find time and proceed with this. It is very
right, sir.
important that in our country we proceed and do all these things, because sometimes it is very important that in cardiology new drugs should come up, and sometimes
Right,
new devices should come up,
right, sir.
and collecting the patient data is very important because we need to have an idea of a disease in terms of its mortality, in terms of its complications, in terms of the adverse effects of the drugs we use as in real world experience. All these are very important for policy making.
Correct, sir.
It is very important that we all develop interest, research interest, and then dedicate some part of our life to do research.
Right, sir. I will add on to, from my side, sir is the principal investigator for more than five international clinical trials, and which are very well known, like Paradigm and Paragon, and recently we have completed our Manipal heart failure registry and report HF. So this was done in Manipal under the surveillance only, under the search supervision, and he is very much into the research, and he always encourages us and our young fellows to do research in cardiology. Yes, sir. So I'll move to my next question. Sir, would you like to brief the special precautions could be taken while managing the CV patients, cardiovascular patients during this COVID-19 pandemic, from your perspective?
Yeah, the COVID pandemic has affected all of us, and it is very important that we are all cautious but do not panic. So, too, is my suggestion to all cardiology patients. Even though we all know that patients who are at heart failure and cardiac patients are at increased risk to develop COVID-19 related complications, it is very important that all the patients are cautious but at the same time do not panic. They continue to take the medicines as prescribed by their doctor, and at the same time they should always maintain the social distancing, frequent hand washing, wearing the mask when they go outside, and also they should avoid visiting the clinics unnecessarily. If
Yeah.
the patient is fine, they can continue with their medicines and maybe do a teleconferencing or teleconsultation, and then if things are fine, they can just carry on with their medicines.
Right,
But the
sir.
two keywords would be cautious but don't panic.
Right, sir. So what is your suggestion for the fellow clinicians, sir, while they're managing the COVID patients?
Yes, all my fellow clinicians have been working hard to treat the COVID patients, and I really appreciate them for the efforts they put. It is very important that we keep doing this work so that we all overcome this pandemic together.
Right, sir. Thank you. So I'll go to my next question. Sir, as Manipal Heart Failure Study Registry (MHFR) was one of the very good and one of the largest study in India on heart failure patient. Would you like to give a brief about the study?
Yeah, the Manipal Heart Failure Registry is actually a registry of heart failure patients. It is a single center study of our institution, and we have screened about more than 2 lakh patients, and we have identified and we are following up more than 2,500 heart failure patients over the last 3-4 years.
Right, sir.
So the data collected is immense, and so I'm so happy that you were very deeply involved in the study. And I think by the end of 3 years and 4 years, we'll have a very large, long-term follow-up study of heart failure patients. And this is going to be wonderful. And I'm so happy that we have collected so much of data. And we have collected data not only in terms of mortality, complications, and other morbidity. We have also collected data in terms of the financial and the psychosocial
Yes,
aspect of the
correct,
heart
sir.
failure patient. So
Right, sir.
it's really wonderful.
Right, sir. Thank you. I'll go to my last question. Sir, as we know, our youth is not much into the interest, much into the research activities, as they have their college engagements, practical engagements, and all. But still, how would you like to motivate or encourage them for the research, especially, sir, MBBS students or MD students and our pharmacy graduates who wants to, who are not much interested into the research? How will you encourage them, sir?
On one aspect, I am happy that compared to 10 years back, more and more interest is coming into research. Our institution as well as the government agencies are actually encouraging a lot of researchers and funding a lot of research ideas.
Right, sir.
And in terms of students, I'm so happy that the PhD students are motivated much, and many of the young people are joining PhD to involve themselves in research. But as you already know, research is a time-consuming way of life, probably, that we can say like that, and it takes time to come to a real result. And
Yeah.
very often in the present world, the youngsters would like to have relatively quick results, and probably that is why
Yeah.
the result is little
True.
less. However, as I told earlier, we have reached here because of research, and we will be moving forward from here because of research. So research is very important, and it is very important that if you have some interest as a young individual in research, then you identify a good mentor who can encourage you, motivate you, and as a team you proceed together so as to have new ideas and execute new research projects.
Yes.
I
So
wish you and your team of young people in achieving what you set out for.
thank you very much. So I will add on to this. So students of MBBS and the pharmacy graduates can come up with the short cross-sectional studies as well, and they can write the case reports. They can come up with some idea of commentaries, some small review papers. So they can do research in many ways. If they are not having time to conduct an original research study, original research with patients, so they can come up with that. So thank you very much for coming, and I appreciate your time, and I'm really glad to see you with me here. Thank you very much, sir. Thank you very much. I'll
Thank
just
you very much, and best wishes for your research activities in the future.
thank you very much, sir.
Thank
Bye,
you.
sir. Bye, bye, sir.